His mother died when he was 2 years old. His father had already left for another woman in another district, Kitgum in northern Uganda, just a few hours' drive away from Nwoya, his home district. His grandmother says he has only one name, Opio. At her request, I give him another, Patrick. I name him after my father. Patrick Opio has for long been an unhappy child. Today he gets news that father pushes him into desolation.
Yes, 2 infections, malaria and HIV. We need to screen for malnutrition, of which clinically this child is already malnourished.
There are fears that Opio could also be having TB. But first things first, the 3-year-old has to be treated for malaria.
Yeah, this is second line, and because with BS 3+, coartem will not work.
In case of malaria, you treat malaria first because that is a curable disease. Then you go for the HIV. You can do simultaneous treatment because the treatment for malaria basically is a few days if it is simple malaria. But of course, if it is severe, then there is more to it.
International health specialist Dr. Myers Lugema, also working in the malaria control program at the Ministry of Health, says the mixture of diseases, however, compromises the recovery rate of the other.
Malaria and HIV are bedfellows. If one has HIV and gets a bout of malaria, he's likely to worsen much faster than one who is HIV-free. Likewise, if one has malaria and gets HIV, he's likely to worsen.
9.5.
A thorough examination of Opio reveals that he is indeed acutely malnourished with marasmus. And so, besides the malaria treatment, he has to be started on a nutritious diet.
It's not a surprise. HIV, malaria, all these are diseases that can make one lose appetite, and you have nothing to put on your muscle, so you get wasted.
At the laboratory, the technicians believe his CD4 cell count will come out no more than 100. However, at the end of 20 minutes, it's good news. It's at 417. Now he may start his HIV medicine, but it may not be that easy with malaria.
Antiretroviral drugs and some antimalarial drugs. There is that interaction that if one was on both drugs, one is likely to delay the absorption of the other drug.
Some cases of severe malaria, however, require that malaria be treated last. Long-standing malaria in most cases leads to anemia by depleting the red blood cells in the body.
Start with blood transfusion before you go ahead with the treatment. Anemia is more emergency, anemia and dehydration.
In 2010, you may recall that when there was a blood shortage, the shortage had been due to very high levels of severe malaria which had occurred and where they are transfused a lot of it. So basically, blood is important, and in the last 3 months when we had a blood shortage, I think malaria could have lost quite a big component of patients in that aspect.
Our blood bank is even prioritized for this unit now. This unit and maternity.
In Anaka Hospital's pediatric ward, most children stream in. Actually, now the medical officers tell us that most of the children are brought here when they have severe malaria.
Because our simple malaria tends to hide in the community there. And we find people as far as Puran, as far as Rungola, as far as Amoro, La Terre-Dong, as far as Coach Goma coming here with the severe form.
So if like there were 100 children here, how many would be having malaria?
If there were like 100, I'll tell you there would be like 80 of them with malaria.
Those were there?
Yeah. See, severe malaria. Inside there also fever with convulsion, which is still severe malaria.
The registers here show it clearly, even though experts say it is reducing.
So within the next 9 months or so, every 2 Ugandans will be having 1 mosquito net to prevent them from getting malaria attacks. As for indoor residue spraying, we are spraying mainly in the north with our partners, and we have sprayed over 11 districts, including government funding in 1 district in the east.
They assert that spraying as a government policy has helped reduce the mosquito density.
Right now in our data, malaria is number 2 following acute respiratory tract infections.
Most health workers revel in the treatment, and through the drug push system, which can be irritating at times, they have more than enough anti-malarials.
The child has improved and gone home today.
The register has some deaths as well.
But it's very rare. We try our level best to reduce the child mortality.
On average, malaria kills a child every minute according to the World Health Organization. The global deaths are estimated at over 600,000, most to children under 5 in Africa each year. Uganda is known to lose 320 people every day due to malaria, amounting to over 100,000 deaths per year, and with a high incidence rate.
There are fewer deaths today than there was in the last 4 or 5 years. Even if it was one person reduced, it is a reduction, but we believe it is much greater.
But according to some health workers in Nwoya district, there are hindrances that may keep the number where it's at.
When the child maybe come after midnight when the generator is off with the conversion, sometimes you want to give IV treatment, it will become thoroughly impossible to put the line using lamp.
When we run out of fuel and we identify a case that needs referral, we will always consult and cancel the caretaker of the client, such that he should know we have the vehicle, we have the driver, but the problem would be the fuel. So if he or she feel he can contribute, not daily, once in a while.
Many caretakers like Opio's grandmother can barely feed themselves, let alone spare change for fuel. Poverty is characteristic of many people here who get the most burdened with disease. Extreme poverty eradication, diseases like malaria, TB and HIV, as well as reducing child deaths, are UN Millennium Development Goals that are expected to be met by 2015. In sub-Saharan Africa, however, the progress is slow, especially when it comes to co-infections of the most deadly of diseases, like what lies in Patrick Opio's body and many children here. Opio's 8-year-old sister has also been diagnosed with HIV today and risks having severe malaria.
We should not be having people dying from malaria because it is preventable and curable.
Some countries like Armenia have been certified by WHO as being malaria-free, and Uganda's health experts say they'll push on with the most basic of measures, including sustained behavioral change communication, to combat malaria, the leading cause of illness and deaths. Florence Naluyimba, NTV, Nwoya District.